V Love Hub.
Back to another episode of V Love Hub. We've got a hot topic to discuss today: aging. We all age. We all get old. We get wrinkles. And you know what? Is there anything we can do about it? I think so. So today we have Dr. Lexie Peterka, the founder and CEO of LP Wellness and Aesthetic in New York City. Welcome to V Love Hub, Dr. Lexie.
Thank you guys for having me. I'm really excited to jump on this topic with you guys.
We're excited too because we need to know all about it.
Yeah. So can you tell us a little bit of what your wellness center does?
So my wellness facility focuses more on wellness and aesthetics, treating the whole body as a whole. We like to focus on mental health, physical health as far as internal medicine, chiropractic, rehabs, podiatry, internal medicine, orthopedics. So we have a whole array of things that we really focus on the wellness side. And then we also have, of course, our aesthetics side. So we like to keep people inner beauty beautiful and the outer beauty to match with it. So that's what we focus here on LP Wellness.
Sounds like a healthy balance. Hopefully we can all strike that. But now, Anne, you met Dr. Lexie a couple of months ago because you got a treatment in her clinic, right? So you're going to share with us what the treatment is?
Sure, Judy. I can't believe you gave it all away. This is natural now. I'm joking. Actually, I went to see Dr. Lexie and we did a Pdo Thread. I'll let Dr. Lexie tell everyone about it. She's better at it.
Mm-hmm. All right. So Pdo Threads, Pdo stands for polydioxanine. It's a polymer. Basically, it's a fiber that is made by polymers, and it's biodegradable, so our body breaks it down naturally. And it is excreted. So once the body breaks it down, it's excreted right into the urine. So it's out of your body within 6 to 9 months. Sometimes if we have longer Pdo threads that last longer, they'll last up to a year, which is great. Pdo threads, yeah, go ahead.
No, is it, so it helps the threads help to pull everything up? Is that how it works?
You kind of have to look at threads as like a suture, right? The medical industry has been using sutures for decades. In the 1950s, we started using sutures. So, cardiovascular surgeons, orthopedics, maxillofacial surgeons really used these sutures to help and lift things in place with surgery. So, doctors came up with this fantastic idea that, wow, we can use this to create collagen underneath it and lift at the same time. We just have to place it in a different area. So that's what we did. And that's how Pdo Threads kind of came about.
Okay. And how do you feel having done the treatment? What's your feeling?
Okay, so my feeling was I wanted something to look natural, and I didn't want something that, going to look like I was so pulled back. So what I did was I just had a little lift. I told Dr. Lexie I like my wrinkles. I like my laugh lines. I want to keep it. It'll look natural. So what she did was put threads going this way and a little bit here. And I got a slight lift, and it wasn't painful. You do get what did you call it? The numbing injection. And I did get a bit of bruising, and but overall it was painless. And I like the result because it's not like everyone looked at me and it's like, oh yeah, she went and had something done. Most people are like, well, I don't know. I don't really notice something, but you look a little different. But it was more like that.
Okay, well, I have to say, don't hate me, Anne or Dr. Lexie, please, but to be really perfectly honest, I don't see a difference. Anne is beautiful before she had the treatment, and she's still just as beautiful. And maybe that's the goal of having this kind of slight treatment done. But I don't notice it in her. But it begs the bigger question, which is, why do we feel this pressure? I mean, Anne is a beautiful woman, but even she feels, and maybe more so, she feels this pressure to look eternally young. So what is going on with us?
Vanity.
I think the movement is, we are so put in front of the camera with social media platforms. We are constantly looking in cameras and getting pictures taken. And I mean, our whole world and our whole lives kind of revolve around social media and what we put on the internet, right? So the big thing is that, and I wanted to touch base with this, is that I'm glad that you have noticed subtle differences, because to the patient will notice a big change because you don't see the skin every day, right? You just see, wow, she still looks great, right? So that's what's important, is that Pdo Threads are such a non-surgical, non-invasive procedure that, we think of the idea like, pulling things back, and, we think of surgery, right? Because that's what you do. Facelifts are just lifted and tightened, and you really see, this a big significant difference. But with threads and non-surgical and non-invasive procedures, which many people are kind of following the trend, right? Because natural is better now. People want to look beautiful with no wrinkles, but they want to do it naturally, right? And we see that movement with celebrities, a lot of celebrities too, right? And I think people are just, following the trend, and that's what we're supposed to do, right? Follow the trend.
Mm-hmm.
Interesting. Yeah. How did you get into this field of medicine, cosmetic medicine?
So I first started out in the holistic aspect of medicine. I was really a fan of like how the body just naturally treats ailments, and I'm a really big advocate of chiropractic medicine and physical therapy and stretch therapy, yoga. I'm really big into Pilates as well. So I really think that the movement kind of shifted when I wanted to do wellness, and then I wanted to do the beauty aspect of it, right? Because I think I was seeing so many people out there that just were looking not normal. And we still see it, right? Like a lot of reality TV shows, these celebrities are just going way overboard with these fillers, and it's not a good look for them.
Yeah. Could you tell us the difference between the fillers and Botox? What's the difference between them?
So fillers is actually like a hyaluronic acid based substance that we inject near the bone tissue or deep into the muscle layer or near the bone to create that fullness effect. Botox is a neurotoxin, and it slightly paralyzes the muscle to give it less movement, right? So both preventative medicine treatments, but totally two different aspects of what look you're really looking for.
And are there any side effects from either of these?
Well, there's side effects with everything that we do.
Yeah, post-treatment. I mean, is there anything common?
Yes, and you could have some potential bruising, redness, irritation at the injection site. Sometimes with fillers, depending on people who aren't well versed in fillers, they will create lumps and create granulomas into like lip areas, and unevenness if they're not really well versed in aesthetics. So those are some of the things that you could do that have side effects.
Back to Pdo Threads. When you're tightening it, is there can you just pull the threads as tight as you can, or are there I noticed there's through different lengths of threads. How does that work?
So the lengths are primarily based on which area of the face that we're going to be working with, right? So, and also the patient's face, right? So your length could be different from a man's length or another woman who has longer bone features than you do. So it really, has to primarily affect what type of thread we will use is how each patient is going to be different. So length really makes, it's what the patient looks like and what's going to be the best interest for the patient.
And it's only used on the face. The threads are only used on the face, or yeah.
Threads are used everywhere.
Oh, really?
Everywhere in the body. Everywhere in the body that we can actually pull something. Neck, breast lifts. We've been doing breast lifts, natural breast lifts with threads. Butt lifts with threads. Knees. A lot of women, older women, have sagginess in the knee area, and they like to have that lifted up. So there's a lot of areas. Abdomen. We've been doing tummy tucks to really tighten that skin, because when we get older, we lose the elastin in the skin on the abdomen, especially for women who've had children. So they start noticing that right away. That little area is where the skin starts kind of bunching up in the abdomen area. So we've been treating that as well.
So there are a lot of women walking around with a lot of threads all over themselves.
Sign me up.
You want to know about it. Yes.
But where do you draw the line with cosmetic surgery? Like, do you have a line that you say, okay, no mas, no more, lady, you've just done too much? You do? So tell us about something like that. What happens?
So for my motto, it's all about, I want to enhance your natural beauty and just give it a little pep talk, right? That's what I want to do. I don't want to have any of the doctors here overfill. We're not into that. In my facility, I am a firm believer in less is more. And that's what I go by. And my doctors here, I train them to be just like me and to make sure that that's the look that we are looking for. We want your natural beauty. We want you to walk out with a little bit of frown lines or a little bit of lines underneath we don't want to get rid of who you are as an individual. And I think that's the problem. People are just going overboard with it and doctors are not turning it away. And saying to the patient, listen, let's do a coaching session. Let's do a life coaching session and kind of figure out like what's going on with you internally, right? Because if you're looking at yourself and you're seeing a different aspect of what we're seeing, let's talk about it. Let's sit down and let's get more in depth about what's going on personally with you.
Right.
So have you ever actually told a client? Have you actually said to a client, and do you have a life coach?
Yeah, I had a patient last week. She had been coming in back and forth, and she was she had a procedure done here, and it was a nose procedure, and the procedure was just flawless. She looked beautiful, and she was in the industry, the beauty industry, the fashion industry. So her look was so important to her. But I think the realization of when people use these filters on Snapchat, they want to look exactly like the filter looks, right? And it's just impossible to have like that look, unless you do some implants or you go into plastics and, you go overboard and go ahead and do that surgical procedure. But yeah, she kept coming in and finally I said, we need to just sit down and have a health coaching session and a life coaching session. And so she was like, okay, she was really, at first she was a little apprehensive about it. But then as I started breaking down some layers in the patient, I was able to figure out and see what was really the problem at hand. And it wasn't, she had body dysmorphia. She looked at her body and thought she was this raging, overweight woman and, with this wide nose. And, we really had to like measure and take measurements of different, celebrities and kind of put it on paper for her. Like, this is what you are. These are the guidelines that we've showed you. And this is where you fall. And she couldn't believe like that a lot of it was in her head. So, we've been treating her now. So with, life coaching more so now. And she's kind of taking a break on the aesthetics, which is great because that's what we really want to focus on. Right.
Well, if Anne comes in to see you again, send her to the life coach. Okay. So let's talk about some of the other procedures you do. And I know there were others that Anne had mentioned, like thermage and fractura. Like, what are all these things? Yeah. So what happens?
So thermage is obviously it's a laser. It's a radio frequency. So it's used by heat. And what we do, the laser heats up the deep layer of the skin where the collagen is. And what the heat does, it evaporates the water molecules out of the collagen and it tightens that skin area. So totally different procedure. It lasts anywhere from 6 months. Yeah, about 6 to 9 months. Some people get the procedure done twice a year. But yeah, we get really great results from patients who see sagging in the neck area, in the decollete area.
And what's the downtime for that? Is there what is it? Your skin drying out and peeling or anything like that?
So you do get some redness. You definitely need to stay out of the sun. And let your skin heal. So the downtime could take anywhere from, with thermage, you can walk out and go to work, but you need some sunscreen and you're going to feel a little flushing and redness into that area. Some people, take some pain medication depending on your pain level tolerance. It totally depends on the person.
So your skin doesn't peel off or anything. It's just red.
Yeah, it's just red and irritated. If you're talking about peeling, that would be like a chemical peel. And a chemical peel is basically a chemical burn, right? You burn off a layer of the skin. And yes, that is some downtime. You're at home for 2 weeks peeling with lots of sunscreen when you go out.
One of our listeners sent in a question, which is, what is moon face and how does that happen?
So moon face is, we use it by medical sign, the conversion of the man on the moon, right? The big moon face, right? But what it is, it's like people who have, let's say they have a pituitary tumor and it's secreting hormones, more than usual hormones. So they have that growth factor and it creates fat deposits and it looks like a round moon face. We use that terminology in aesthetics as well, because more and more women, especially on the older side, are looking like that moon face because what they're doing is that whoever they're going to get injected with, they are filling them and overfilling them with hyaluronic acid. And it's causing that really puffy bunchiness face that looks like a moon. So yeah.
Okay. So we've got to avoid
over injection. Anything for cellulite treatments?
You have shockwave treatment. And what it does, it kind of warms up the cellulite, the fat deposits underneath it. It kind of zaps the fat deposits underneath that. As far as by the thighs and the butt area. So we do that here. And we also use Sculptra. Sculptra can be used underneath, injected into those pockets, because that's what it is. It's just kind of fat deposit pockets that are uneven in the skin. So we can lay down some Sculptra in those pockets and allow Sculptra to really like grow.
So Sculptra is an injection that you put on. Okay. And how long does that last?
Sculptra can last up to a year.
And the other procedure, sorry, what was that called?
Shockwave therapy. It's done with a machine, yeah.
And how long does that take in it?
So that takes literally 15 minutes to do. And you're in and out of the office. It usually requires like 6 treatments. So 6 times to come in and get zapped. And yeah, so I mean, we've had some really great results.
And now, cellulite is mostly genetic, right? Is it so? But it also can be from inactivity. So, are you saying that these products are? If I'm a couch potato and eating, bags of chips every day and sitting down, not doing anything, but I could come in and get rid of my cellulite, or will it? Yes.
Yeah.
You could do that.
It's a great thing about it. Yeah, there's a lot of genetics that, are factored into having cellulite, but there are great procedures that are really on the market right now. Shockwave therapy is one of them, and Sculptra is another one that give great results for cellulite treatments.
And someone had asked me about, is there anything that they can do for like bags under our eyes?
So we just have this great procedure that we just came out with.
Something new?
No.
Something new. It's called, I named it the Chanel Injections. I'm a fan of designers, so Chanel is one of the best. So when I saw this procedure done, I had training done at the Royal Academy in London, and this procedure was just phenomenal. So what it is, it's semi-permanent tattooing underneath the dark circles, and we're using pigments, semi-permanent pigments, to match the skin tone, and tattoo kind of underneath the eye to give it that nice natural cream look. So it's beautiful. It's refreshed. The procedure takes about 30 minutes to do. We numb up the area underneath the skin, match the pigment to the patient, and voila, we're on our way.
That's like a treatment for dark circles. What about for bags, for puffy bags?
Okay. So puffiness bags, obviously, that is genetic, right? A lot of us, Asians are one big, I'm Asian, so genetics are really big into that. And it's, either you can get the fat pad taken out, and, it's a simple procedure, aesthetically with plastics, right, with surgery. Sculptra, we could put some Sculptra underneath that area just to balance it out more. But bags is really hard, because you don't want to put a filler underneath it if there's a big fat pad already in there. And because what happens is, hyaluronic acid, it literally takes water molecules and attaches to it. So when you're already swelling up and you drank too much, or, you just woke up and you're just, you just have these big, Festoons, they're called Festoons, which are fat pads. There's nothing that you really can do, and you don't want to put, hyaluronic acid or filler on top of that, because you're going to really look uneven and you're not going to be happy with the procedure. So, unfortunately, there's a simple, when you have those, fat pads that swell, there's not much you could do but to get them removed.
Someone wanted to know, we went over this a little bit, the neck treatments. I know the Pdo threads you can do. Are there fillers for it as well?
Yeah, so we could do radius, and we fill the lines, the neck lines with radius, and it's great. It really is. It lasts around about 8 months to a year. So it actually is, I like it, and people really love it too. We also do mesotherapy as well, and it's a vitamin cocktail, and we kind of just give tiny little injections all the way around the neckline, and kind of give your that collagen a nice little boost underneath there with the vitamin cocktail. So that works wonders.
Are you finding that more men are coming in for treatments? Are they more open about speaking, about admitting to having treatments?
Yes. Yes, we have tons of men who come in and get threads done. It's a great procedure and they love it, Just like, our insecurities, men have insecurities as well. And, they like to have that nice strong jawline. And, we do a lot of procedures for jawlines for them. Scalp pigmentation, men are going bald, and we could really fill in that line and give them a nice line, a hairline again, and give their confidence back. So yeah, we've got a lot of men who come in and share their experiences here as well. We do not discriminate.
Well, asked, what is the difference between beautification and rejuvenation?
Beautification and rejuvenation. Well, rejuvenation is you're actually doing something to the skin, whether it's, mesotherapy, IPLs, you're kind of doing something to the skin itself. Beautification is just kind of enhancing it with very minimal and non-invasive procedures, facials, vitamin C cocktails, mesotherapy, not really putting anything underneath the skin. Rejuvenating it would be putting something underneath the skin to create a different look.
Anything else that's new or upcoming procedure?
Yes. So I'm really excited. I was just telling you recently that we are going to, my colleague and I are going down to the UK Aesthetics conference, and they have a new line of Pdo Threads that lasts 2 years, and they're filled with hyaluronic acid. So they're basically dipped in hyaluronic acid, so it's getting the filler with the Pdo Thread. So I'm pretty excited about these procedures. And
I wish I was the one who had found hyaluronic acid. I can't even pronounce it, but I wish I was the one who had found it because it's in absolutely everything.
Yes.
Yeah.
It is. Our body produces it naturally, and over a period of time, it just stops producing it. And that's why we lose that elastin. So we just got to keep putting it back in. So that's what we're doing.
Running out of time. That was quick.
Yes, so fast.
Thank you so much. I mean, I love that you're in the job of just making people feel better about themselves. And look, we tend to judge a lot when it comes to cosmetic surgery, but I think we try and also just say no judgments. You do you, right? You do whatever you need to do. Yeah.
That's it. I love it. Thank you for having me.
V-Love Hub is produced by Judy DeMello and Ann Katari.
We've got lots of great resources listed on our website, vlovehub.com. That's VLUVHUB.com.
Follow us on Instagram, Facebook, and LinkedIn. Please rate and review us on Apple Podcasts or wherever you download your pods.